Did you know that your body is constantly sending you important health signals that most doctors never tell you about? One of the most overlooked yet powerful warning signs comes from something we rarely discuss: the way your body smells. Shocking but true, specific body odors after age 65 could be the earliest warning signs of serious diseases that blood tests and scans might miss completely. These aren't just normal aging odors, they are specific chemical signals that something serious is happening inside your body. Leading medical researchers have discovered that people who detect and address these 3 specific body odors early can prevent devastating health crises and add years to their lives. Yet 95% of older adults completely miss these critical warning signs, dismissing them as just getting older or covering them up with perfumes and deodorants, a potentially life-threatening mistake. Today, I'm going to reveal the 3 specific body odors that top medical experts recognize as early warning signs of serious disease. Something that almost every doctor fails to tell their patients about, yet could save your life or the life of someone you love. Let me tell you about Margaret, a vibrant 73-year-old retired teacher from Colorado. For months, Margaret noticed an unusual smell she couldn't quite place. It wasn't her clothes or her home, it seemed to be coming from her skin. She mentioned it briefly to her doctor during a routine visit, but he dismissed it as normal aging. Just use stronger soap, he suggested. 6 months later, Margaret was rushed to the hospital with a life-threatening condition that had been developing silently all that time. The unusual smell had been her body's desperate attempt to signal something was wrong. Her specialist later told her, "If we had recognized what that odor meant earlier, we could have addressed this months ago with simple treatments." Now at 75, Margaret has made a full recovery and has become an advocate for body awareness. "I never knew my body was trying to warn me," she says. "Now I tell everyone I know about these warning signs." What exactly are these potentially life-saving smell signals? Let's break down each of the 3 critical body odors you should never ignore after 65. Odor number 1, the sweet, fruity smell that could signal a medical emergency. Have you ever noticed a sweet, almost fruity smell coming from your skin or breath that doesn't go away with brushing or bathing? This isn't just an unpleasant odor, it could be a medical emergency hiding in plain sight. Leading endocrinologists have identified this distinct sweet, fruity odor as a critical warning sign of diabetic ketoacidosis, a potentially life-threatening condition that affects thousands of seniors each year. Dr. Samantha Rodriguez, head of geriatric endocrinology at Northwestern Memorial Hospital, explains, this particular sweet odor is caused by ketones, chemicals your body produces when it starts breaking down fat instead of glucose for energy. It's essentially your body sending out an SOS signal that something is dangerously wrong with your glucose metabolism. The tragedy is that many older adults either don't notice this smell or dismiss it entirely. Others notice but feel embarrassed to mention it to their doctors, a silence that can have devastating consequences. Consider what happened to Robert, a 68-year-old retired accountant from Arizona. For weeks, his wife noticed a sweet, almost apple-like smell on his breath. Despite his excellent dental hygiene, Robert brushed it off as nothing important. "I thought maybe it was just a side effect of one of my medications," Robert admitted. What he didn't realize was that his body was sending him an urgent warning. One morning, his wife couldn't wake him, he had slipped into a diabetic coma. After a frightening week in intensive care, Robert's doctor explained that the fruity smell had been a clear warning sign of uncontrolled diabetes that had progressed to dangerous ketoacidosis. If we had recognized that smell for what it was, we could have addressed it with simple interventions before it became life-threatening, his doctor told him. Now Robert checks his keton levels regularly and has learned to recognize the early warning signs his body sends him. What causes this critical smell signal? When your body doesn't have enough insulin to move glucose into your cells for energy, it begins breaking down fat as fuel instead. This process releases ketones, which build up in your blood and eventually appear in your breath and perspiration, creating that distinctive sweet, fruity smell, almost like nail polish remover or overripe fruit. People with type 1 diabetes are most at risk, but seniors with type 2 diabetes can develop this condition as well, especially during illness, severe dehydration, or when medications aren't working properly. The most concerning fact is that many older adults develop diabetes without realizing it. The CDC estimates that over 7 million Americans have undiagnosed diabetes, many of them over 65. That sweet smell might be your first and only warning before a serious crisis develops. How to detect this warning odor. Number 1. Morning breath check. Before brushing your teeth in the morning, breathe into your cupped hands and smell. A sweet, Fruity odor requires immediate attention. Number 2. Ask a trusted person, since we often can't detect our own body odors accurately. Ask a spouse, close friend, or family member if they've noticed a sweet smell on your breath. Number 3. Check for associated symptoms ***, excessive thirst, frequent urination, unexplained weight loss, fatigue, or confusion alongside this smell makes the situation more urgent. Number 4. Simple home testing ***, inexpensive ketone test strips are available at any pharmacy and can confirm if ketones are present in your urine. This simple test can provide crucial information if you notice this smell. If you detect this sweet, fruity odor, especially with any accompanying symptoms, don't wait, call your doctor immediately or go to urgent care. This isn't something to monitor for days or weeks. It requires prompt medical attention. Remember Margaret from earlier? She recalls, "The smell wasn't strong at first, just a sweet odor I noticed occasionally. I wish I had known what it meant." Her story reminds us that our bodies often whisper before they scream. Learning to listen to these subtle signals could save your life. Odor number 2, the ammonia-like smell that reveals hidden organ dysfunction. The second critical smell that should never be ignored after 65 is an ammonia-like odor, similar to cleaning products or cat litter, that seems to emanate from your skin or breath, particularly during or after physical activity. This distinct smell isn't just unpleasant, it's your body sending an urgent signal about how your kidneys and liver are functioning. Unfortunately, most people either don't recognize it or mistake it for normal aging odors, potentially missing a critical window for early intervention. Dr. Michael Chen, nephrologist at Mayo Clinic specializing in geriatric kidney health, explains, this ammonia-like odor is often the earliest detectable sign of declining kidney function, sometimes appearing before blood tests show significant abnormalities. It happens when your kidneys can't properly filter waste products, particularly urea, which then get excreted through your sweat and breath. For older adults, this warning sign is particularly crucial. Kidney function naturally declines with age, but a pronounced ammonia smell can signal that something more serious is developing, from kidney disease to certain liver conditions or even heart failure that's putting strain on these vital organs. Take James, a 71-year-old retired engineer from Ohio, an active man who enjoyed daily walks. James started noticing a strong ammonia smell on his skin after exercise. "I just thought I needed stronger deodorant," he recalls. He increased his showering and applied more antiperspirant, effectively masking the symptom without addressing the cause. At his annual physical months later, his doctor was alarmed by his kidney function tests. "Why didn't you mention these symptoms earlier?" his doctor asked. The ammonia smell had been an early warning of kidney dysfunction that had been silently progressing for months. Had James recognized this smell for what it was, his doctor could have intervened sooner with medications and dietary changes to slow the progression. "Now I know my body was trying to tell me something important," James says. Through early intervention with medication and dietary changes, James was able to stabilize his condition, but he wishes he had understood the warning signs earlier. What causes this critical smell signal? This ammonia-like odor occurs when your body can't properly eliminate urea, a waste product formed when proteins are broken down. Normally, your kidneys filter urea from your blood and eliminate it through urine. When kidney function declines or when your liver can't properly process proteins, urea builds up in your bloodstream. Your body tries to find alternative ways to get rid of this excess urea, through your sweat glands and respiratory system, creating that distinctive ammonia smell. This smell often becomes more noticeable during or after physical activity when you're sweating more. For people over 65, this warning sign is particularly important because, number 1, kidney function naturally declines with age, making older adults more vulnerable to kidney disease. Number 2, medications commonly prescribed to seniors, including certain blood pressure medications and pain relievers, can affect kidney function. Number 3, conditions common in older adults like diabetes and high blood pressure can damage kidneys over time. Number 4, early kidney dysfunction often has no other noticeable symptoms. What makes this smell particularly concerning is that by the time other symptoms of kidney problems appear, like swelling in the ankles, fatigue, or changes in urination, significant damage may have already occurred. How to detect and address this warning odor? Here's how to monitor for this important warning sign. Number 1. Post-activity smell check ***. After light exercise or activity that causes you to sweat, notice if there's an ammonia-like smell from your skin or breath that seems disproportionate to your exertion level. Number 2. Morning smell assessment ***. Your breath and body odor are most revealing when you first wake up, before bathing or brushing your teeth. An ammonia smell at this time warrants attention. Number 3. Clothing check. Sometimes the ammonia smell is more noticeable on clothing after it's dried. If workout clothes or nightwear consistently have this smell even after washing, it's worth investigating. Number 4. Hydration test. Increase your water intake for several days, unless you have restrictions. If the smell diminishes significantly, dehydration may be contributing, but still mention it to your doctor, as dehydration itself can strain kidney function in older adults. If you detect this ammonia-like odor, don't panic but do take it seriously. Schedule an appointment with your doctor specifically mentioning this symptom. Request comprehensive kidney and liver function tests, not just the basic screenings. For James, recognizing this smell earlier could have meant starting treatment months sooner. I wish I had known that my body odor was trying to tell me something important about my health. He reflects. His experience reminds us that paying attention to changes in body odor is not about vanity, it's about vital health awareness. Odor number 3, the musty, mothball-like smell that could signal neurological disease. The third critical odor that should never be ignored after 65 is perhaps the most surprising, a musty, mothball-like smell that seems to come from the skin, particularly around the neck and upper back. This unusual odor isn't just an unpleasant scent, it could be one of the earliest detectable signs of certain neurological conditions, appearing years before more obvious symptoms develop. Leading neurologists have identified this distinctive smell as a potential early marker of neurological changes, including Parkinson's disease and certain types of dementia. Dr. Eleanor Thompson, neurologist and researcher at Johns Hopkins University, explains, "We've discovered that specific brain changes alter the composition of skin oils, creating compounds that have this characteristic musty odor. In many cases, this smell appears 5 to 7 years before tremors, memory issues, or other recognizable symptoms. This connection between smell and neurological health isn't widely known, even among medical professionals. As a result, countless older adults and their families miss this critical early warning sign, losing precious years when interventions might be most effective." Consider Elizabeth, a 69-year-old retired librarian from Vermont. For nearly 2 years, her husband noticed a strange, musty smell that seemed to follow her despite her immaculate hygiene. "I bought her different soaps. We changed detergents, but nothing seemed to help," he recalls. They were both too embarrassed to mention it to her doctor. During a routine physical, Elizabeth mentioned in passing that she'd been feeling slightly more tired than usual. Thankfully, her doctor was one of the few familiar with emerging research on odor changes and neurological conditions. After a comprehensive evaluation, Elizabeth was diagnosed with early-stage Parkinson's disease, long before tremors or other obvious symptoms appeared. Her doctor told us the smell had likely been present for years, and was one of the earliest signs of the neurochemical changes happening in her brain. Her husband explains, because of this early diagnosis, Elizabeth was able to start neuroprotective therapies and lifestyle interventions much earlier than most patients. 3 years later, her condition has progressed much more slowly than typical cases, and she maintains an excellent quality of life. "If we had known to pay attention to that smell, we might have gained even more time," Elizabeth says. "I'm grateful we caught it when we did, but I wish every older adult knew about this warning sign." What causes this critical smell signal? This distinct musty, mothball-like odor stems from chemical changes in sebum, the oily substance produced by your skin's sebaceous glands. In certain neurological conditions, particularly Parkinson's disease, the autonomic nervous system functions differently, altering both the amount and composition of sebum. These altered skin oils contain elevated levels of specific compounds, particularly certain aldehydes and hydrocarbons, which create that characteristic musty scent. Fascinatingly, some trained medical professionals and even some individuals with particularly sensitive noses can detect this smell years before any movement or cognitive symptoms appear. Research at the University of Manchester has shown that this smell is so specific that specially trained dogs can identify people with Parkinson's disease based on smell alone, even before any clinical diagnosis. This remarkable finding highlights just how powerful and important this smell biomarker is. For people over 65, this warning sign deserves special attention because 1. Early intervention in neurological conditions like Parkinson's can significantly slow progression. 2. The smell often appears 3 to 7 years before more recognizable symptoms develop. 3. Other early symptoms like slight stiffness or minor sleep changes are often dismissed as normal aging. 4. Most doctors don't routinely ask about or check for smell changes during physical exams. How to detect and address this warning odor. Here's how to monitor for this important but subtle warning sign. 1. Clothing collar check. The smell is often most noticeable on the collar of shirts or nightwear, particularly after being worn for a day. A persistent musty, mothball-like odor that returns quickly after washing warrants attention. 2. Third-party verification. Since we often become noseblind to our own smells, ask a close family member if they've noticed a persistent musty odor that doesn't seem related to environmental factors. 3. Location specificity. This smell is typically strongest at the nape of the neck, upper back, and sometimes the scalp, areas with more sebaceous glands, rather than underarms or feet where other body odors are common. 4. Persistence despite hygiene. If excellent hygiene practices don't eliminate the smell, or if it returns quickly after bathing, this suggests it's coming from metabolic changes rather than external factors. If you or a family member notices this distinctive odor, approach the situation with sensitivity but take it seriously. Schedule an appointment with a neurologist, specifically mentioning this symptom and any other subtle changes you may have noticed, such as changes in handwriting, becoming smaller or more cramped, slight stiffness or slowing of movement, acting out dreams during sleep, reduced sense of smell, constipation that has no other explanation, changes in voice volume or tone. For Elizabeth, her husband's observation of this unusual smell led to a diagnosis years earlier than most. We had no idea that something as simple as a change in body odor could be connected to brain health. She says, "Now I tell everyone I know to pay attention to these changes and take them seriously." What to do if you notice these warning smells? If you've identified any of these 3 critical odors, sweet, fruity, ammonia-like, or musty mothball, don't panic, but do take action. Here's your step-by-step plan. 1. Document the details. Before calling your doctor, gather specific information that will help them assess the situation. When did you first notice the smell? Try to pinpoint when it started. Is it constant or does it come and go? Note any patterns related to time of day, activities, or meals. Where on your body is the smell most noticeable? Different locations can provide important diagnostic clues. What does it smell like exactly? Be as specific as possible in your description. What have you tried already? Note any changes in hygiene products, diet, or medications that didn't resolve the issue. Any other symptoms? Even minor changes in energy, sleep, appetite, or movement could be relevant. 2. Approach your doctor effectively. Many physicians aren't trained to consider odor changes as diagnostic clues. Here's how to ensure you're taken seriously. Be direct and specific. I've noticed a persistent sweet, fruity smell that doesn't go away with bathing is better than I think I smell funny sometimes. Frame it as a medical concern. I've learned that certain body odors can signal health issues in older adults. Shows you're approaching this as a health matter, not a hygiene issue. Request appropriate testing for fruity odors. Request glucose and keton testing. For ammonia odors, ask for comprehensive kidney and liver panels. For musty odors, request a neurological evaluation. Bring a family member. Having someone else confirm the smell can add credibility to your concern. Be persistent. If your doctor dismisses your concern without investigation, consider seeking a second opinion. 3. Consider these immediate supportive measures. While awaiting medical evaluation, these steps may provide important information or temporary relief. For fruity odors, monitor blood glucose levels more frequently if you're diabetic. Stay well hydrated unless restricted by your doctor. Have someone check on you regularly if you live alone. Keep emergency contact information readily available. For ammonia odors, increase water intake if not medically restricted. Temporarily reduce high-protein foods. Avoid strenuous exercise until evaluated. Track your urine color and output. For musty odors, don't increase bathing frequency to extreme levels. Avoid harsh soaps that can strip natural oils. Keep a symptom journal noting any small changes in movement, sleep, or mood. Consider adding movement activities like Tai Chi or dancing. Remember Margaret from the beginning of our discussion? Her persistent smell turned out to be the ammonia-like odor we discussed. My doctor initially dismissed it, but I insisted on comprehensive testing. She recalls, that persistence saved my kidneys from further damage. Now my doctor checks for these smell changes in all his older patients. The life-changing impact of understanding your body's smell signals. These 3 critical odors, fruity sweet, ammonia-like, and musty mothball aren't just unpleasant inconveniences. They're sophisticated warning systems your body has evolved to signal when something isn't right, often before other symptoms appear or standard tests show abnormalities. For Robert, recognizing the sweet, fruity smell as a warning sign of diabetic ketoacidosis could have prevented his diabetic coma. For James, understanding the ammonia smell might have led to earlier intervention for his kidney function. And for Elizabeth, the musty, mothball-like odor provided a crucial early warning of Parkinson's disease, allowing her to begin treatment years before most patients. These aren't isolated cases. Dr. Rodriguez emphasizes, in my practice, I've seen dozens of patients whose first detectable symptom of serious illness was a change in body odor. Those who addressed it early consistently had better outcomes than those who ignored or masked the smell. Think about what early detection could mean for you or someone you love. Disease caught at earlier, more treatable stages. Prevention of emergency situations and hospitalizations. More time to implement lifestyle interventions and gentle treatments. Better quality of life for more years. Greater independence and continued activity. Peace of mind knowing you're addressing problems proactively. All of these benefits can come from simply paying attention to something most of us have been taught to ignore or mask: our body's natural odors and how they change. At 75, Margaret now serves as a volunteer health advocate for seniors in her community. I tell everyone to pay attention to their body's signals, especially these smell changes. She says, it's not about vanity, it's about understanding the sophisticated way your body communicates when something isn't right. That awareness saved my life. Your body's early warning system. Start listening today. Your body speaks to you in many ways, but few signals are as overlooked as changes in body odor. These three critical smells, fruity sweet, ammonia-like, and musty mothball, deserve your attention, especially after age 65 when your risk for the associated conditions increases. Most doctors don't routinely ask about odor changes, and many older adults feel too embarrassed to mention them. But breaking this silence could literally save your life or the life of someone you love. Start today by becoming more aware of your body's normal smells so you can quickly identify changes. Perform the simple smell checks we've discussed. Educate friends and family about these important warning signs. And most importantly, advocate for yourself if you notice changes. You know your body better than anyone. Remember Elizabeth's husband who noticed that unusual musty smell years before her Parkinson's diagnosis? Don't ignore what your nose is telling you. He advises, it might be the most important health tool you have. If you found this information valuable, hit the like button right now and subscribe for more life-saving health information that most doctors never share with their patients. Comment below which of these warning signs you're going to start checking for tomorrow morning. Share this video with someone over 65 whom you care about, especially if they've mentioned unusual odors they can't explain. You might literally be giving them the gift of early detection and better health outcomes. Your body is constantly communicating with you. Are you listening?